Abbott is the only company with point-of-care diagnostic solutions along the entire HIV cascade of care. Explore our HIV POC solutions. Our HIV diagnostic solutions enable life-saving decisions to be made that have a powerful impact on people, government, and society. The Determine TB LAM antigen test empowers you to diagnose active tuberculosis in HIV patients, providing results in just minutes. The first and only rapid urine-based test for the early diagnosis of TB in HIV patients with WHO certifications and DOH guidelines. Determine HIV Early Detect. The first and only WHO 4th generation's HIV rapid test kits. New possibilities in patient care by closing the window period and detection as early as 12 days of infection. Just add 50 UL of serum, plasma, or whole blood. The MPIMA analyzer brings HIV viral load testing to a wide range of decentralized settings. Quantify both HIV-1 and HIV-2 in just 70 minutes with less sample volume. Our rapid CD4 test helps caregivers establish a baseline immune function and assess clinical outcome, expedite treatment and management decisions, generates absolute CD count, comparable precision and accuracy, flexible small amount of blood using fingerstick or venous whole blood samples, compact and portable. In response to this plight, we have developed BioLine HIV Syphilis Duo, a point-of-care diagnostic test which simultaneously tests for syphilis and HIV in one pass, with only a single drop of blood. Join the path to elimination by maximizing PMTCT program. This time-saving, cost-effective solution is an important component to any PMTCT program. The world's most sensitive rapid diagnostic test for detection of hepatitis B, surface antigen using serum, plasma, and whole blood, with an analytical sensitivity of 0.1 IU/ml, and can detect major vaccine escape mutants. Know if it's COVID-19 or influenza, so you can act with confidence. Timely, accurate testing is the first step toward protecting patients facing COVID-19 and influenza, especially high-risk patients, so act quickly with one test for timely differential diagnosis. Simultaneous detection of dengue antigen and antibody cover all clinical stages from acute phase to convalescence phase of infection. Fast test result, 15 to 20 minutes. BioLine Malaria. Rapid test kits distinguish PF infection from other species, PV, PM or PO. Useful in regions where all malaria species are circulating. WHO pre-qualified. Clearview fecal occult blood. Accuracy of the test is not affected by the diet of the patients. Result in just 5 minutes with simple procedure. Post-sample preparation, minimal training required. BioLine Salmonella. TIPE IgG IgM Fast is a solid-phase immunochromatographic assay for the rapid, qualitative, and differential detection of IgG and IgM antibodies to Salmonella type. Curometer 720, urine chemistry analyzer, high capacity, maximum 720 tests per hour. BioLine Syphilis 3.0 test is for the qualitative detection of antibodies of all isotypes, IgG, IgM, IgA, against Treponema pallidum. BioLine HCV test is a test for the qualitative detection of antibodies specific to HCV in human serum, plasma, or whole blood. BioLine HAV IgG IgM rapid test is for the rapid qualitative and differential detection of IgG and IgM antibodies to hepatitis A in human serum or plasma. The BioLine Leptospira antibody test is a rapid, qualitative, and differential test for the detection of antibodies, IgM or IgG, to Leptospira interrogans in human serum, plasma, whole blood. The BioLine Filariasis is an in vitro, visually read, immunochromatographic test for the qualitative detection of circulating filarial antigen from Wuchereria bancrofti. Rapid drug screening test for methamphetamine and THC. The complete solutions for rapid test kits by Allied Hospital Supply International Corporation. Introducing our 4-in-1 meter for glucose, uric acid, cholesterol, and hemoglobin, our Best Check meter. Headway headquarters is located in Shenzhen Bay Area. The core engine of FHE Greater Bay Area. Our mission is to make the pursuit of health easy. We are contributing our efforts to provide non-invasive diagnosis solution. To make the pursuit of health easy. After decades research and development, our scientists designed the 14-carbon UBT system to discover the H. pylori infection. Headway is the primary supplier of 13C and 14C UBT system for H. pylori diagnosis in the world. Headway owns completely independent intellectual property rights of breath test technology. Integrates research, development, production, and sales. Product Quality Testing Lab. Analysis Lab for products and raw materials. Quality inspection of raw materials. And Stability Testing Lab. The gold standard for H. pylori diagnosis, 14C Uriath breath test system, which is an advanced diagnostic tool to detect Helicobacter pylori. The test is accurate, non-invasive, and rapid. Vexillium POCT CLIA. Accurate, convenient, consistent, rapid, and economical. Introducing our Vexillium Chemiluminescence Immunoassay Analyzer. Calibrator and controls are included per box of reagents that can save cost for Cal and QC. Cartridge type for all immunoassays. Disposable sampling tip and multiple magnetic separation, avoiding carryover interference. Complete tests for cardiac marker, inflammation, fertility, thyroid, bone metabolism, tumor markers, infectious anemia, brain injury, allergy and autoimmune disease, and diabetes. Suitable for hospitals, emergency and ICU, clinics and laboratories. Vexillium POCT. Chemiluminescence Immunoassay Analyzer, distributed by Allied Hospital Supply International Corporation. Keep exploring as we yearn for the unknown. Pursue the ultimate as we reverence for life. The Vexillium Automated Urine Analysis Assembly by Allied Hospital Supply, with innovative modular design, processing 4 prominent characters: fast speed, high precision, comprehensive projects, and humanized design. The assembly line is composed of dry chemistry module, formed element module, sample catching and recovery modules. With 1+2 modes, the detection speed can be up to 360 samples per hour. Dry chemistry detection. The minimum sample size is as low as 1.5 ml. The sample dropping accuracy is as high as 0.2 microliter. The ability of resisting VC and color interference is excellent. The dry chemistry module is equipped with patented technology integrating 5 physical and chemical detection indicators. Formed element detection. The sample can be enveloped after the sheath flow pool. Which makes sure the formed elements pass through the image acquisition area in the form of monolayer cells, without accumulation and overlap. 400 times optical microimaging, combined with high-speed imaging technology, can take 2,000 pictures with 1.5 million pixel in 10 seconds. The flow cytometry technology and apochromatism microscopy high-speed imaging technology perfectly integrates high sampling volume with high-definition image acquisition. AI identification technology, CNN, uses big data and AI artificial intelligence algorithm to automatically and precisely recognize and classify all captured formed elements, realizing the excellent detection rate and recognition rate. The dry chemistry module provides 14 dry chemistry analysis, 5 physical and chemical items, including quantitative AC detection, which provided more accurate diagnostic basis for kidney diseases. Formed element module can perform 28 formed element detection and 5 clinical prompt functions, which are RBC source, RBC histogram, urine culture, urinary tract infection, and microscopic view. In morphological analysis, the detailed classification of red blood cells and tubular types is beneficial for the location of the renal lesions, which provides diagnostic basis for the course of kidney diseases. The combined interpretation of dry chemistry and morphology provides more comprehensive detection methods and judgment basis for the diagnosis of kidney and urinary diseases. One-click operation and fully automatic detection. Truly unattended operation. Up to 600 sample locations can be expanded. Sample information can be automatically identified, and the whole process can be traced. It is equipped with an emergency position. Samples can be tested at any time. Non-stop reagents loading and remote cloud service function can be realized. Decipher the micro world. Reveal the human mysteries. See the truth in the details. Fixilium, urine sediment analyzer. Medical technologies powering a healthy future. By Allied Hospital Supply International Corporation. Introducing handheld iCheck, blood gas and electrolytes analyzer. iCheck can be used in various settings like emergency, operation room, ICU room, and NICU, clinics, and ambulatory. iCheck cartridge is BG7 for 7 parameters, which consist of pH, partial pressure oxygen, partial pressure carbon dioxide, potassium, sodium, ionized calcium, and hematocrit. Return cartridges to room temperature. Inject sample after calibration, which avoids RBC effect on hematocrit. RFID on board. 7 tests and 15 calculated parameters. 60 seconds test time after sample injection. Minimum 95 UL sample. Features of iCheck blood gas electrolytes analyzer. Speedy in just 1 minute. Accurate, safe, and easy to use. Handheld iCheck. Blood gas analyzed, distributed by Allied Hospital Supply International Corporation.
MALDI-TOF mass spectrometry is a versatile analytical technique to detect and characterize mixtures of organic molecules, especially large synthetic polymers and biopolymers. MALDI stands for Matrix-Assisted Laser Desorption Ionization. This ionization method involves a laser striking a matrix of small organic molecules to make the large, fragile analyte molecules into gaseous ions without fragmenting or decomposing them. TOF stands for time of flight, a mass spectrometry method that separates ions by their mass-to-charge ratio and determines that mass-to-charge ratio by the time it takes for the ions to reach a detector.
Mass spectrometry to identify yeast and molds and mycobacteria in the laboratory much more rapidly, much more efficiently, and more cost-effectively than some of the traditional methods that we've used for many decades before. So traditionally, these are areas that are difficult to identify. Mycobacteria and molds, they grow very slowly. It takes a number of different tests that the lab technologist has to do to identify a particular yeast or a different fungus. The beauty of MALDI-TOF is it's one technique, one test. You get the answer what it is for a variety of organisms. So it's been very powerful.
Intuitive interface of software synchronously displays identification result and morphological reference. In addition, the scientific research, homology analysis, etc. are available. MALDI-TOF MS system has been widely used in clinical departments, CDCs, customs inspection, and other fields.
EXS 2600
Mass spectrometry system, a convenient and rapid identification tool for microbiology labs.
Innovative technology by Allied Hospital Supply International Corporation.